Well, there are three diseases, malaria, tuberculosis, and HIV, that kill over 6 million people a year, most of them in the developing countries in Africa. There is not much research to develop vaccines against these diseases because the people who suffer they cannot pay for this vaccine. So international organizations like the World Health Organization and private foundations, especially the Gates Foundation, have been willing to provide the funds to develop vaccines for these diseases. The issue that my PhD student Jason Su and myself have been devoting ourselves is to study what is the best way of providing funds so that pharmaceutical companies engage in this type of research and development. In the literature, there are two ways of subsidizing, promoting research and development in cases where it's not profitable for the companies to do it on their own. One type of method would be what we call push programs, which subsidize the cost of research and development. The amounts of money required to develop a successful vaccine or any other pharmaceutical product is of the order of $1 billion, and the average time it takes is about 10 years. So taking this into account, the funds required are very substantial. So one way, the push programs subsidize this cost. They provide a certain proportion of the expenses that the company would be doing. The second type of subsidy program would be to subsidize the revenues at the end. Let the company put their own funds in developing these products, but at the end, commit to a large quantity at a certain price. That's why they are called quantity price commitments, that they will be, that the sponsor, the agency, the Gates Foundation or the World Health Organization would be willing to buy this. So in these two procedures, the company will have the funds necessary to engage in this R&D development. The literature so far does not provide an analytical framework to compare these two alternatives. It only gives the advantages and disadvantages of each one of them, as the main disadvantage of the push programs, that is to subsidize the cost of research, is that there are agency problems. There are asymmetric information between the sponsor and the company, so the sponsor can never be sure in reality, in practice, where the funds are being spent, whether all the funds are being spent in the particular research that is being promoted or in some other activities of the company. The main disadvantage of the second method, the pool programs, is that you have contracting issues. Since it takes a long period of time, 10 years to develop the vaccine, the sponsor has to agree to start buying 10 years from now from the company, and the company then has the problem to whether the sponsor will be there in 10 years, whether it can commit to the large commitments of funds. What we do in this research is we develop a model of valuation of R&D investments, which allows us to deal with this problem in an analytical way, allows us to determine what is the best way to provide the funds. And we have a very sophisticated model with many variables that includes the efficacy of the vaccine, the cost of investments. All of these are random variables that are uncertain, versus uncertainty, and many others. And then we allow the company, the pharmaceutical company, to optimize among these variables and decide when is the right time to invest and stop investing if the product is not successful. R&D projects are not only very expensive and they take a long time to accomplish, but the failure rate is incredibly high. There are some estimates that over 80% of the R&D projects in the pharmaceutical industry that enter the clinical trials, those are trials with humans, fail. So only 20% succeeds. And that means that the risk for the pharmaceutical company is very high. And they have to decide when they are along an R&D project when to abandon a project. We conclude that in general, the pool programs, those that fix a certain amount to be bought and fix a price, are better from a social point of view in terms of the amount of vaccines provided, the quality of the vaccines, and other variables that we have in the model. Moreover, by analyzing a kind of contract that was not in the literature, what we call a hybrid contract, which is a mixture of the two, where you provide some money for initial research and development, but at the same time you provide for a quantity, price, purchase commitment at the end, turn out to be the most effective ones. And we, along our project, we have been in touch with the Gates Foundation because they have been interested in what we are doing. And clearly one of the challenges to apply this technology in practice, which is the stage we are in now, is to get the data that is required for the model. And the Gates Foundation has been giving us data so that we could actually get numbers which can be applied in practice. This is really, I'm a finance professor, this is really a project that is more than finance, it's really economics, health economics or policy. But the techniques that we use to solve this problem, which is called real options, is a technique that was developed in the finance area.